All right, so good morning, good morning, everyone. Welcome to a very special edition of Tuesdays with Top, right? My name is Tiffany Charles. I am the Teen Outreach Program Manager here at the Partnership for Maternal and Child Health of Northern New Jersey. I have three very special and amazing guests with me today. We are actually going to be talking about LGBTQ youth and how we can necessarily empower them, giving them information that is medically inclusive, right? And also that can benefit their health overall. So just in case you don't know anything about my program, the Teen Outreach Program, right, also known as TOP, we are a sexual risk avoidance education program. So we actually work with middle school youth in Northern New Jersey. We actually give them information that can benefit them as far as reproductive health and things of that nature when it comes to healthy relationships. And we also actually work with their parents as well. So one thing that we definitely do in our program, we actually work with LGBTQ youth who may identify as transgender, non-binary, things of that nature. So I'm actually going to talk to Camila, right, from Horizon. Thank you so much for joining us. So just give all of our viewers, all of our listeners, just a little bit about who you are and what it is that you do.
Sure. Thank you so much for having me here. I'm so excited. As you mentioned, my name is Camilla Votary. I am a registered nurse at Horizon Blue Cross Blue Shield of New Jersey. So in collaboration with other health professionals, educators, and members of the community, we plan and implement community level public health initiatives that address social determinants of health. I work closely with community, state, and school-based organizations to provide free, culturally competent health education to the public. So my role is to improve the health and well-being of the communities I serve through education, disease prevention, health promotion, and access to quality healthcare for all.
Awesome.
So I know it's a lot to say, but we do a lot, right? We wear multiple hats. And I think that includes all of us, not just.
Yes, thank you so much for sharing. So I actually have a question for you. So you do work with LGBTQ youth, correct?
Correct.
So what's some of the information that you actually share with the community that you should serve?
So specifically, so here at Horizon, we strive for a culture of excellence, and that is to promote diversity, equity, and inclusion, not only in the workplace, but to the people and members that we serve every day. And that also includes the youth, right? So when supporting young people, we infuse these principles, right? Diversity, equity, and inclusion to become welcoming, safe places where all belong. I want to quickly just break down the meaning of these terms because I think that some folks are not understanding of what, we use that word, those three words a lot, but some people may not necessarily know what they are. So diversity it means like seeing and accepting without biases, right? All human characteristics, experiences and identities that make us unique as individuals and members of communities and cultures. Then we have equity, right? So equity is discovering, creating, and providing what is required, requested, and measured by each human to feel equal. So we want everybody to feel equal regardless of anything, right? And then lastly comes inclusion. So we want to ensure everyone is invited to contribute, to be seen, to be heard, feel valued, and be counted in a way that is safe and makes sense for them, right? So we want to ensure the delivery of culturally and linguistically competent services and support care, and to work to ensure that who you are, where you're from, or the circumstances that surround you don't determine your access to healthcare experiences or opportunities. So we want to include everyone and be able to, that, specifically with the youth, that they're able to find healthcare and the needs that they need, right? Whether it's through their insurance, and particularly with other within the youth, they don't necessarily like to use their, insurance because they're under their parents' insurance. So providing federally qualified healthcare clinics, which they have in all 21 counties in New Jersey, is important. And just the education overall, even what we're doing now, is super important so that they know that, we provide a voice for them, or a place where they can go where they feel safe, is also very important.
Awesome. Thank you so much, Camila, for sharing. It's definitely important to make sure that we do have information or provide services that are, very diverse, equitable, and make sure that it is very inclusive, right? Because not everyone is the same, right?
Yeah.
What are some trends that you actually see? What are some challenges that you might see with the LGBTQs that do come to your office and actually receive the education that you provide?
So we don't necessarily have an office. I work directly with other organizations, but from working with the youth, especially in schools, right? I do a lot of health education with schools and specifically high schools. And some of the challenge that the LGBTQ youth have is difficulty in opening, discussing sexual health related topics, right? They have difficulty finding healthcare where they feel included and accepted, right? And this is really for the general LGBTQ population. It really comes from the experiences that they have in healthcare, like the stigma and discrimination during their lives that ultimately impact, negatively impact them wanting to even seek medical care. So some more, there's a lot of other specific things that I notice. For example, this goes specifically to the transgender population. They experience a lot of concerns in terms of their menstrual cycle, right? Having access to those products is a big issue amongst the trans and transgender and non-conforming people, right? They feel like as though ashamed to go and buy those products, right? Because everything has a label as a woman. And even though they have woman parts, they don't identify as a woman, right? So I think it's important to give them access to those services in terms of finding products. So I want to actually mention, since we're on this topic on menstruation, that this is for Hudson County. So in Jersey City and all the Jersey City public libraries, the Flow Initiative, which is an organization that we work closely with, they provide free menstrual products for all individuals. And that's with no questions asked, right? So you can just go up into one of the Jersey City libraries and they're able to provide those products for anyone who may need it, right? And then there's also the YMCA in Newark for those folks in Essex County. The YMCA in Newark on Broad Street also provides free menstrual products for anyone, regardless of race or gender identity. So I think this is all important information that I want to share with you all to have, right? And please pass that information along to anyone who you think may need these products as well.
Awesome. Thank you so much, Camila, for sharing. I know that's definitely an issue, right? A lot of our LGBTQs might not go seek this information because of, like you said, that stigma, right? They're afraid of disclosing their identity, how they identify, and they don't want their parents to actually know about them seeking this information or even seeking the services, right? These medical
Absolutely.
services.
Absolutely.
Right. I know that in New Jersey, these services can actually be, sought out without their parents actually knowing. Is this true? Is this correct?
Yeah. So when my advice to anyone seeking services, you have the right to ask questions, right? When a youth goes in, for it's especially LGBTQ youth, goes in to get services, whether it's with their women reproductive health or any type of services, especially in terms of STDs and HIV testing. Ask the question, is this information going to be safe? Are you going to share this information with my parents? And usually it's not shared. It's something it's a confidentiality they have between the patient, right? And their provider. So again, I always encourage everyone, ask the question, feel, you want to find a location where you feel comfortable with, right? And you feel important, that you're being trusted, right? That you can trust your provider. I think that's important. If you go to a doctor where you're not trusting them, right? Then most likely that person is not going to share important or pertinent information in terms of their health. So there are a lot of LGBTQ plus doctors and providers that are accepting, right? And that provide that inclusive care for that community, right? And that they can better serve that community and that population. So always ask that question. And for most cases, it's going to be something that's confidential between patient, the youth, right? That's asking the information, and the provider, the doctor and the nurse, the whole staff, really.
Thank you so much for sharing. So you mentioned, of course, STDs, STIs. So that actually is a great segue transition into my next guest. So we have Ureni, who actually works here at the partnership as well, right? So one of the things that she does, I'm actually going to let her introduce herself. I promise, I promise. But one of the things that she actually does is educate youth on a specific, very specific STI, right? So Ureni, please introduce yourself and let everyone who's watching know what it is that you do here at the partnership.
Absolutely. So thank you so much for having me. My name is Ureni Syme, and I am the Public Health Program Coordinator for the Adolescent Immunization Program here at the Partnership for Maternal and Child Health. And so what I do is that I provide education and information on HPV.
All right, thank you so much. So for those of us who might not know what HPV is, right? We're like, what is that? We might have some basic information. Can you just go into it a little bit? What is HPV?
Absolutely. So I'm going to give my little spiel on HPV, and just to introduce it. So HPV stands for human papillomavirus. It is the most common sexually transmitted disease, surprisingly. About 14 million people, including teenagers, become infected with HPV each year. That's a lot of people. Approximately 79 million people in the United States are currently infected with HPV. And the reason why HPV is so dangerous is because it causes cancer. And so HPV can cause cervical, vaginal, and vulvar cancer in people with a vagina, and can cause penile cancer in people with a penis. It can also cause anal and oropharyngeal cancer in everyone. So for those who don't know, oropharyngeal means mouth and throat cancers. The most common HPV-related cancer for people with a vagina is cervical cancer. And the most common cancer is oropharyngeal for people with a penis. It also causes genital warts, which are not cancerous, but they are highly contagious and very uncomfortable. And so, in addition to that, HPV can be transmitted through oral, anal, and vaginal sex. It can also be transmitted through genital on genital touching. A lot of people may not know that. And so HPV is the most common among people in their late teens and early 20s. Those who have HPV often don't even know that they have it and can pass it on to others. And the reason why is that HPV shows no symptoms. It is unlike other STIs. We know that other STIs present physical symptoms that you can see, you can test for. However, HPV is very different in that it presents no symptoms. And so while in many cases, the body clears itself up of the infection on its own, this unfortunately isn't the case for everyone, right? So if it doesn't clear up on its own, it can live dormant in the body for many years and can cause cancer many years later. And so many people end up finding out of an HPV infection through a cancer diagnosis. And we don't want this, right? This is something that we want to prevent. We don't want to find out that we've gotten an HPV infection through a cancer diagnosis. That's when it's way too late. We can't do anything about it anymore. And so while there is no cure for HPV, I like to share with everyone that there is a vaccine that can prevent HPV-related cancers. Some questions that I get is like, what are some symptoms of, this vaccine? And I say, well, it can cause mild side effects similar to other vaccines that we know of, like Tdap and flu, but they don't last long and they go away on their own. It is over 90% effective in preventing cancers, and the earlier that they are received, the better. They are more effective as early as possible that you can get them. Children as early as 9 years old can get their HPV vaccine. So we recommend everyone get as vaccinated as early as possible. And that's pretty much my quick spiel of HPV and talking a little bit about the vaccine.
Thank you so much for sharing, Ureni. That was super informative. I hope everyone is taking notes. This is really great information. Thank you so much. So you mentioned that HPV unfortunately is not curable. There's no cure, but is it treatable? Is there a treatment for it?
So while there is treatment for genital warts, there is no treatment for HPV itself. Once it's in your system, it's there. And so the best thing that we can do is to prevent it before it lands in our system. And also another piece of information that I want to share is that if a person is already sexually active and they unfortunately, are exposed to a strain of HPV and they get their vaccine afterwards, that vaccine will no longer protect them of the strain that they were already exposed to. So that's another piece of information. There is no treatment. And so we want to make sure that because of this, we are protected as best as possible, as early as possible.
Wow, thank you so much, Ureni. So get vaccinated, right? Definitely. So that's actually going to lead me into my last guest. So Melissa, who also works here at the partnership, she's actually going to talk about the vaccine, right? The HPV vaccine, just immunization, right? So, Melissa, please introduce yourself. Tell us what it is that you do here at this wonderful agency that we work for, right? And then, how can we get vaccinated, right? What's some info that we should have?
Of course. Thank you so much for having me. My name is Melissa Hart. I'm the program manager for the Adolescent Immunization Initiative here at the partnership. So just to give a little background on our program, we provide education to both healthcare professionals and the community on the importance of adolescent vaccines. Most of the time, our focus is on the HPV vaccine because it is one of the required vaccines for schools. And when we look at that vaccine compared to other vaccines, we do see like a lower uptake. So most of the time, that's where we focus our education. So yeah, really our program is to spread awareness at community health fairs. We also can provide information on flu, COVID vaccines. We go into schools to provide education as well on different vaccines.
Awesome. So where can people get vaccinated? Where can they get the HPV vaccine?
Yes, so they can get vaccinated at their private doctor office. If they have a private doctor office, they can go there. They can go to their pediatricians. Federal Qualified Health Centers are a site where they can get vaccinated. Also, Vaccine for Children providers. So Vaccine for Children is a program that can give uninsured and uninsured individuals access to vaccinations. So it will cover the cost of it, and also local health departments as well.
Awesome. So is there like an age requirement or a recommended age that people should go and get vaccinated?
Like Ureni said, as early as possible for the HPV vaccine, starting at age 9. The sooner they get the vaccine, the better, because as she was saying, once you're exposed, you're not able to be protected against that strain. So the sooner before any type of sexual activity.
Awesome. Thank you so much. That is so great. Thank you, thank you, thank you, all of you for joining us. I hope everyone who is watching, I really feel like everybody should have been taking notes. This was such great information, not just for our LGBTQ youth, but just everybody in general, right? So I feel like we can definitely make sure that our youth and even adults are feeling empowered with the medical information that they're receiving. So Camila, I have one more question for you before we actually wrap up and say goodbye to our awesome viewers. What resources do you have for, our youth and even adults, like as far as, even LGBTQ specifically, what resources are available?
Well, I think I mean, excuse me, I can share definitely with you some of the services that LGBTQ plus communities have. Like I work closely with Hudson Pride, which is, I think, the partnership as well. It's important for the LGBTQ youth to have or have a place where they can go to that they feel connected, right? That they feel like they can share that information, like people of the same, that have the same values. So I think I can share Hudson Pride's information. I know they serve Hudson County, but they really serve majority of the northern part of the state, right? Essex County, Passaic, and the surrounding counties as well. For those that don't have insurance, right? or don't qualify for healthcare or don't qualify for Medicaid, I can certainly share with you the federally qualified healthcare clinics in all 21 counties in New Jersey that you can share, not only for the youth, but also for adults who may also, seeking access to quality healthcare. And really just, I can look up other resources as well, specifically to the LGBTQ plus communities. My suggestion is, if you're in school, right, to find like a teacher or someone that you trust, right, that you can go to share important information, because that's another issue that the youth face as well, is that they don't feel like they have an adult person that they can come to share this information, right? Because they're isolated from their parents and they really only talk maybe amongst a small group of friends, right? So just know that we are all here to help serve those needs, right? Not just us, but also the partnership as well, right? So just find a trusting adult that you can come to, that you can share that information, especially if you're experiencing bullying or anything like that. That's important. Your school nurse is always a good person, or your social worker, if there is a social worker in your school.
Definitely.
I'll share that with you, okay?
Awesome. Thank you so much. And of course, it will be posted onto our Facebook page and other social media outlets as well. And thank you once again to all of my guests, Camila, Ureni, Melissa. Thank you so much for providing such great and wonderful information. Thanks to all our viewers, and I hope you enjoy the rest of your day. Bye, everyone.